Welcome to Well-Advised Medicare 101, Basic Steps in Getting Started with Medicare. My name is Mimi Roberson, and I'm the Chief Operating Officer of Well-Advised. I'm a former Chief Executive Officer of 4 hospitals. I have a passion for enabling every person to have their best health and access to care. With me today is my colleague, Dr. Robert Morris, Chief Medical Officer and a founder of our company. In the first 30 minutes of our presentation today, we will cover the basics of Medicare, and we will answer questions sent to us in advance of this webinar. The final 30 minutes, we will walk you through the Well-Advised online tool, which guides you to learn which Medicare option is best for you. So what is Well-Advised? As I said earlier, it is a free, unbiased advisor, which captures every single Medicare plan, hospital, physician, pharmacy, prescription drug available where you live. Well-Advised links this information to your personal preferences. It is a web-based product, and it is powered by a sophisticated artificial intelligence engine, which assures that your Medicare selection is private, confidential, and non-biased. So what problem are we solving with Well-Advised? We are providing a better Medicare experience. Medicare is complex, it's overwhelming. People don't know how to access and pay for the care they need. A surprising statistic is that 94% of enrollees are in a suboptimal plan, and 87% of people never change their plans. So Well-Advised is a free, unbiased health advocate. It guides individuals to optimum coverage. We use artificial intelligence to find your optimal plan. We improve enrollment efficiency and accuracy, and we reduce enrollment time. This solution helps you, the consumer, navigate the myriad of options, focusing on your clinical and financial health throughout your Medicare life. So Medicare 101, let me introduce you to Dr. Robert Morris. Dr. Morris, please join us.
Thank you. Thank you, Mimi, for that introduction. I'm going to do 2 things. We're going to go through an overview, essentially, of what Medicare is, and deal fairly briefly with some big topics. And then in the second part, we will go through our own online questionnaire that helps us to help you. And that will be in more detail. So first of all, Medicare, what is it? It's a national program, first of all. It's designed for people who are age 65 and older, also for people under 65 who receive disability benefits for a period of 2 years or more. The program is organized and regulated by the federal government, but in fact, it's usually provided by private companies, private physicians, private insurance companies, private hospitals. So there are several parts to it. And I'm going to deal mainly with the 3 big ones, which are Part A, Part B, and Part D, that I'm sure all of you have heard of. Part A is essentially for hospital inpatient care. It covers you while you are officially an inpatient. Covers all your expenses there, and it provides cover for the physician services that you receive and for any drugs that you receive. We'll come on to say what I mean by cover, because cover does not mean that the Medicare pays for everything. Far from it. Part B is for other medical care outside the hospital, such as your primary care physician services, outpatient care, x-rays, lab tests, and so on. Part D came in 2006, and this is for prescription drugs. This covers medication that you receive as a result of a physician prescription. In general, it does not cover any over-the-counter drugs. When you turn 65 and join Medicare, you have 2 main choices. One is that you can stay on what is called the original Medicare, which essentially expects you to be fairly self-managing in your health. You have to select your own doctors and hospitals, there are no networks. You can do it anywhere in the country that accepts Medicare, but it does not cover your drugs and it does not cover any out-of-pocket costs. So you need separate insurance to cover your medication and separate insurance to cover at least some of your out-of-pocket costs. That is the costs of premiums, the costs of the co-pays and so on that I'll talk about in a second. The other big choice is what is called by many different names, unfortunately. The main name that Medicare uses is Medicare Advantage, or Part C. C, I always think of as being something that's probably comprehensive. In other words, it covers all of your services, both Part A and Part B. In other words, hospital and outpatient care. Typically, these plans cover your drug insurance as well. The downside to Medicare Advantage is that all of your care is managed through your personal physician, which has its pros and cons, and is managed within a referral network. Networks tend to have a bad name with HMOs in the past, but networks these days are fairly large and trouble-free for most people. The third big thing here, which I've just referred to really, is that Medicare is not free. We sometimes get people who have an expectation that it's all going to be free. It is not. The government expects everyone to share in the costs of Medicare, not just with monthly premiums, but also by sharing the actual cost of care that you receive. Next slide. So how do you get onto Medicare? Is it automatic? Well, for some people, it is automatic. If you are receiving Social Security retirement benefits, not disability, but retirement benefits. In other words, you're getting your pension, say early at 62 or 63. When you reach 65, you will be automatically enrolled in Part A and enrolled in Part B. And if you don't want Part B at that time, you have to tell Social Security that that's what you don't want to have for whatever reason. We can go into that. Social Security manages this process of enrollment. And it does so because Social Security keeps track of the Medicare taxes that you've paid in either your working life or your spouse's working life. So what are the parts? Part A typically comes at 65. As I said, it covers your hospital care, your inpatient care. You can enroll 3 months before your 65th birthday month and enroll 3 months after your 65th birthday month. And that makes 7 months altogether. And we call that an initial enrollment period. And typically for most people, because they paid Medicare taxes, you do not have a premium. Part B is a part of the Medicare, as I said, that is essentially for outpatient care and primary care physician and physician care altogether. So when do you need to sign up? You don't have to sign up when you reach the age of 65. And there are times when we would recommend that you don't sign up. And one of those big times, for instance, is if you are on an employer's health benefits, which are going to continue after you're 65. You don't need to pay Part B at that stage. But for most people who are not on group health benefits from an employer, you probably will need to sign up for Part B. It's going to cost you. This year, premium Part B is $148.50 a month. So you, in looking at what Medicare is going to cost you when you reach 65, it's just worth remembering that everybody has to pay that. If your income, if you're lucky enough for your income to be higher, you may have, that premium may in fact double or sometimes even triple in cost per month. So I talked about a choice before. So you've got to choose between original Medicare and Medicare Advantage. And we recommend that you choose that at when you turn 65, because there are pros and cons of both. And there are some issues about whether you can swap between them when you're older. Remember that with original Medicare, you get your Part A, which your inpatient hospital coverage, but you need to add on drug insurance, prescription drug company plan, and your out-of-pocket costs as well, because you're going to have shared costs, which can be considerable. And in original Medicare, there's no full stop for those. For Medicare Advantage, more comprehensive insurance, you get some additional benefits for it. There's a lot more competition for Medicare Advantage, and some, excuse me, and for many plans, those additional benefits make a great difference to people because they are things like dental care, vision, hearing, and sometimes other things, acupuncture and some home care as well. So we can recommend those two choices. Medicare Advantage tends to be, excuse me, I've got some whole lot of pollen around. Medicare Advantage tends to be less expensive, certainly earlier on, but it can be more expensive later in life. Whereas original Medicare carries a certain cost, but it does prevent you from getting huge additional costs from Medicare in the future. So the third area that you've got to do is to select a type of plan. The type of plan for Medicare Advantage that I'm talking about is whether that plan is a health maintenance organization, an HMO plan, whether it's one that's a mixture of an HMO with some choices outside a referral network. And that's what PPOs, PFFSs, and some MSAs mean. SNP is a special needs plan. For some people with chronic illness, they can get a particular plan which is very much focused on their illness, whether that's diabetes or chronic lung obstruction or something similar. So the Medicare Advantage plans have several types. We prefer, on the whole, the simple HMO plan, which is comprehensive, it's easier to understand, and has got better safeguards than PPOs and PFFSs for your out-of-pocket costs. And so that's the one type that we tend to recommend. Most Medicare Advantage plans, as I said before, include a drug plan. So you don't need a separate prescription drug plan with most Medicare Advantage plans, certainly with the ones that we recommend. With original Medicares, I said before, you need a prescription drug plan. These are not very expensive. We have some in Colorado, for instance, that are under $10 a month. They cover most of your costs for drugs, but not all. So there's always a copay, insurance to be charged. And you also need what is called a Medicare supplement plan, or Medigap. Medigap is the term that's very often used for these policies. They are policies that cover, to a large extent, the additional costs, out-of-pocket costs that go with original Medicare. So there are very many different types of these Medicare supplement plans, Medigap plans, and they have letters by their name. The big thing about these plans is that they are very heavily regulated as to what they contain. They have to cover certain things that the government lays down that they must cover. The difference between them, between the companies that provide them, is purely cost. So if a company A has a Medigap policy. It can charge essentially what it wants, what the market can bear, compared with company B, but the policy is identical for both of them. And it's worth thinking through that and what that actually means, and we can help you through that. So this last section is, what are the things that we should look out for? Because there are some potholes along the pathway in Medicare, quite a few of them. We need to think about enrollment periods. You can join Medicare when you're 65 at any time of the year during that initial enrollment period. So forget about all these adverts at the end of the year. That doesn't apply to you if you are going to be 65. You can join at any time when you are 65 within those month periods that I talked about. That's the initial enrollment period. But beyond that, after that, there are essentially periods when you can switch from the plan that you're on to another plan, or you can switch to a different type of plan, or switch from original Medicare to Medicare Advantage. What are those times? Well, there's an annual or open enrollment that I'm sure you've heard your friends talk about, because it's every time between October the 15th and December the 7th, which is annual enrollment period, there is a glut of adverts on television. You will get a lot of literature in the mail telling you that this is the best plan to join, and this one is better than this one, and so on. What we think of this is a time to review the current plan that you're on and to say, has this been good for me? Am I getting value for money out of it? Am I getting the benefits that I want? And we can help you with that. We send emails to people, and we contact them about their current plan and what we think has changed about it in the coming year, and whether we found a better match for your particular situation. So that's annual enrollment. That's at the end of the year, looking toward the coming year. There is also, and I haven't put it on here, a 3-month period, January 1st to March 31st, when you can also make certain changes to your plans. You can enroll you can switch to another Part C plan, Medicare Advantage plan. You can do 1 or 2 changes to your prescription drug plan, but there are some limitations to that. You can't make changes to a Medigap plan. And beyond that, there are special circumstances when you are allowed by the rules to change your plan, switch to another one, drop one, switch to another one. So moving house is a good example of when that happens, for instance. Can you change your mind? Well, yes, you can. I just referred to it. After initial enrollment, for instance, you have a period when you can change your plan, and it's up to a number of months after you've actually enrolled, and that time varies a little. But we have all those rules set down in our system, and we understand them. The system, more importantly, understands them better than us. You can also change after open enrollment, and that was one of the purposes of the enrollment period from January to March, when you can actually change. And you can change from a different plan that you've tried it for a couple of months and you didn't work, or you've just found it too expensive, or didn't like what was happening to it, or found something better. You can switch insurance companies or plans, Medicare Advantage and drug plans. Can you switch between original Medicare and Medicare Advantage? Question we get all the time. It is easier to switch from original Medicare to Medicare Advantage. In other words, what you do is you drop your prescription drug plan, you drop your Medicare supplement plan, and you join a Medicare Advantage plan that is going to be much more comprehensive and cover you in a different way. What is more difficult rather, is after the initial period, after turning 65, it is more difficult to change from Medicare Advantage back to original Medicare. You can easily drop the Medicare Advantage plan. You can relatively easily get a prescription drug plan. But what is more difficult is to get a Medigap plan, because originally, when you are 65, plans, Medigap plans, have to take you, regardless of any existing illness or existing condition, or past history, in other words. After that time, after turning 65, they can take those existing history into account. They can refuse to insure you, or they can just charge you more. So that is something to be really on the lookout for, and we can advise you on what the chances are to a certain extent. The other thing to think about is the doctors that you go to and select, particularly specialists. Are they in network? Do they accept Medicare? And you need to think about both those things every time that you see somebody who is not your, if you're on Medicare Advantage, who is not your primary care physician, or primary care provider of some form or other. Because there are certain conditions where Medicare allows physicians to treat you, but also to charge you a certain amount more than is typical. And that is something to just be aware of, and we can advise you of that. Fourth thing, sorry, I can't count. Medicare Advantage plans often have what we call the added benefits, and they tend to advertise these added benefits as being the reason you should choose them. And sometimes that's true, but it is something just to be aware of. The majority of Medicare Advantages plans that we advise you to have do include added advantages that are worth considering. These things are vision, some vision cover. It's not complete vision cover. It tends to be optical measurement. In other words, your eyeglasses. Sometimes these include a contribution towards the cost of your spectacles, but not always. Dental maintenance, which is sort of going to have your teeth cleaned. Sometimes there are some additional benefits to that, but it's not necessarily included, and you have to really read the benefits in detail to find that out. And hearing. Those are the typical ones. Sometimes there are other things, as I said before. You may get some transport. There may be a contribution to buying over-the-counter medications at preferred pharmacies, and additional things like that. Acupuncture, I think, is another one that I've seen too. So worth thinking and looking out for, and just being aware that they're not really the reason that you should choose a plan. They are an added benefit, but the real reason is what's the quality of care that you're going to get from that plan. And of course, the last thing that you have to be aware of is people who call you, want your social security number, want all those other details from you on the phone. Be very, very aware. There is a lot of fraud going around in Medicare. There always has been. The people are chasing the fraudsters, but people do get away with it. And a lot of people are injured financially because of fraud.
You know, Dr. Morris, what you've just described to us so eloquently is the exact reason why Well-Advised exists. The complicated nature of Medicare and Medicare Advantage and Medigap and Supplement, all those plans, it is incomprehensible to figure out how well one should be able to determine what's best for them. So thank you and your partners for developing this, because without it, we wouldn't have such clarity. We have a few questions that were sent to us in advance, and I know time is short for our first section here. But the important thing for everyone to know is that we will continue to answer questions and post things questions and answers on our website and on our education section of our website. So if we're not answering a question today, please be on the lookout for when we are able to post additional questions. And if anyone ever has any questions specific to themselves, they are welcome to reach out to us at info@well-advised.com. So Dr. Morris, the first question that we have today is, does Medicare cover all of my costs? I think you touched on that, but I guess the answer is no.
The answer is, you're right. The answer is no. If you're on original Medicare, Medicare will cover generally 80% of the costs of the treatment that you get, physician costs and so on. But you are liable for that extra 20%. And that can be covered, as I said, by a Medigap insurance. If you're on Medicare Advantage, you will have not only premiums sometimes to pay, but although in most competitive areas, urban areas, the competition is such that the premiums tend to be zero, but you will have co-pays and co-insurance. That is, co-pay is a dollar amount that you may have to pay every time you see your own physician or a specialist. And co-insurance tends to be a percentage of the costs, the actual costs of care in certain situations.
Wow. I love this question, Dr. Morris. You referenced earlier in Medicare Part B that there's a mandatory cost per month. Someone asked, do I really need Part B? Must I get it? Because it seems to cost a lot.
It does cost a lot. And the answer is yes, because one of the complications that if you don't is that you won't be able to get a Medicare Advantage plan without it, and you can't buy a Medicare supplement, a Medigap plan without it. Sorry, my nose is streaming.
No worries.
So it's necessary for that. And I'm sorry. If you join late, decide later on to take it, several years after you first could have taken it, Medicare will charge you a penalty, a financial penalty, which means that they will add a certain amount of money to your premium that you will have to pay, and that is for life. So wow. It's really important I think that people don't do that.
Certainly is challenging, is it not? Well, we have other questions that we will be posting on our website. One is talking about the donut hole. So if people are curious to know the answer to the donut hole, look out for our next little short webinar or education series. We have other questions such as what is Part C? Or if I get a doctor's bill, what do I do with it? Or I've lost my Medicare card, how do I get a replacement? So each of these, I mean, obviously Medicare, the whole premise of this is Medicare is very personal. And we want to make sure that we are aligned with all of our clients and be very respectful of what is important to them. And importantly is that everything that we answer for them personally is confidential. So our next steps, which is important for us before we visit with people, is Well Advised really has a process. It's not just a one and done that we provide your recommendation and get you enrolled. What we do is continuously talk to you during the course of the year, provide education, provide resources. We're an avenue to get advice and advocacy. So please don't think that this is just a one shot. We are looking to take care of you through the course of your Medicare lives. So next steps for folks here is we welcome you to stay online and walk through the questionnaire with us, because we want to demonstrate to you how easy it is to do it. But if you don't have the time to do that today, please go to well-advised.com and you will find the resources for you to go through your unbiased recommendation, which is free and simple to use. And important to me as a person who is soon to be enrolling in Medicare, you will not be receiving any spam or unsolicited calls. This is personalized while we handle all the paperwork for you to enroll. So for those of you who are leaving us today, thank you for joining us. Please reach out early and often, and we look forward to partnering with you in your Medicare life. So here is what our web page looks like for those leaving. So as you reach out to us, we look forward to partnering with you going forward. So Dr. Morris, let's take this next opportunity to pivot into our webpage and our questionnaire, and I will guide the slides for you
Thank
to
you.
walk through that.
Right. So in our web page, right in the middle, you will see a red box, which invites you to essentially to go into our questionnaire. And if you click on that, you'll go on to the next side. And here is a very simple check, which just basically is asking you, finding out whether in fact you are eligible to enroll in Medicare. So are you currently enrolled? What's your date of birth? And we need to know what your zip code is. If you're under 65, then we need to understand whether you've had any disability payments and if those have been on for 2 years or more, because that will confirm that you are in fact eligible. We do allow you, if you're not eligible, nevertheless, to Medicare to continue, because we realize that people approaching the age of 65 are interested in what it's going to cost. So that's a little pop-up sign will come saying whether you're eligible to enroll when you fill all that in. And I just fill some spurious information in there. Little brief overview of what you to expect in the questionnaire takes you then on to the big question here, which is what we're interested in is what things concern you about your healthcare. What is it that you want to take into account when we make a recommendation to you? Is it hospital, doctor, pharmacy? Is it a particular insurance company, or nothing at all? If it's your hospital, then we allow you to select a hospital, and here is somebody who's selected Presbyterian St. Luke's, for instance, and then you can add another hospital. Go on to see your physician in the same way, a primary care or specialist, and you choose from a list once you put in a few letters of the person's name, and then you can, so the list comes up like that, and then you can choose that person, and then you can go on and choose a second person, and so on. Pharmacy is very much the same thing. Choosing CVS and plus a local one, and then insurance company. And we ask a separate question here as well, because we're very aware that some people do not want a particular insurance company for whatever reason, and that's so we take that into account. Then we like to look at there's an example, sorry. And then we take into account the medicines you take, because this tells us quite a lot about who you are and what you do. And it also enables us to say whether in fact, just going on a second, whether in fact you have a particular list of drugs that affects you in a way. We also ask a question about prescription drug insurance plan, because that's important from a financial point of view. So then, what is it? Really big questions here about what's Medicare going to cost you? What is it that you think that you're going to be able to afford? All of us, when we reach 65, have had experience of healthcare and coverage and insurance companies, and all of us will have some idea about what it costs out of pocket. In other words, what the insurance companies don't pay, and for many people that's very important. For some people, it's not terribly important. Secondly, we're looking at the question of your assets. In other words, if you're going to pay a hospital bill of $2,500 easily, or whether that's a problem for you. And then the third question here, the big one is how much do you feel that you'll be going to be able to afford to pay for a health plan premium every month?
So
And
obviously, Dr. Mars says we've just asked people online about their medication drugs and their financial preferences. This remains confidential, does it not?
absolutely, absolutely confidential. Yes. Um, we treat this information as though we were providing it to somebody else. In other words, I don't want my information of this sort, financial or my drugs, to be used by somebody else, sold to somebody else. We do the same for you. We're absolutely passionate about that.
Yeah, well, that's one of the reasons I was so excited to join this company, because of the integrity and the ethics. So the
Then,
next step in doing this, once you get this information, what do you do next?
well, we take this information and we say, well, given the sort of things that you prefer and like about healthcare and are concerned about, what's the most important? And for many people, the costs are going to be the most important, or the physician is going to be most important. And here on this screen, you can slide these things up and down and say what's the most important to you. And that's an example there. Then we need to know who you are in order to be able to oh,
God bless you. You know, healthcare is live and in person.
I'm sorry. I'm
You
surrounded
have
by
nothing to apologize for.
cherry blossoms and peach blossoms are all out around here, and
We're
it's
all human, Dr. Mars. We are not a robot.
no, we're not. So you can see we're looking for information about who you are, phone numbers, where you live, and so on. Very standard stuff to enable it. Then some people have got benefits that may impact our choices that we're going to recommend to you. If you have benefits from a current employer, for instance, we like to know what your health plan is currently, because this gives us some idea of what you've been, whether you like Blue Cross, Blue Shield, Kaiser, whatever the plan is. And for both of these, we need to understand when those are going to come to an end. Some people are also on Medicaid as well as Medicare. Some people are federal employees, work in the post office or whatever, and then the military. Some people have for whatever reason, the employment has ended and they've gone onto this thing called COBRA, which is essentially a continuation of the health plans they had. It tends to be very expensive, or there may be some other things like the PERA, PERA, which many people are on as well. So we take all those into account, and those are examples of those. And those are basically all the questions that we're going to be asking you. It takes about as long as I've taken now to go through and complete it. I usually think it's going to take somebody maybe looking at it for the first time about 20 minutes to complete. Really not very long at all. We need to know, sometimes it may be one of your children who's going to do it for you, or you doing it for a grandparent or a parent. And we like to know and make sure that you've got permission to do that. As you can see, please confirm that you're authorized to provide the information. And then we also like to know, where did you hear about us? Because this enables us to keep in touch with people and to understand where the people who are needing help are coming from and how they get to us, and enables us to be much more accessible to people in general. You get an email from us when you finish the questionnaire and send it off. And we get a recommendation to you within 48 hours, or that's a couple of working days, in other words, of this being done. The recommendation may be stay where you are. It suits you, it's exactly what you should do. It may be stay where you are. We're going to make a recommendation that you change, but you can't change yet. or we think you should change now. And this is what we would suggest we change to. We then go on and in the process, we will handle all the paperwork for you free of charge. And we make it very easy for you to switch or to join the particular plan that we're recommending.
So what you've just highlighted, Dr. Morris, is the fact that the well-advised tool works so well, whether you are a T65, as we call it, of someone new into Medicare, never having been in Medicare before, aging into Medicare. And it also is an excellent tool for those who are already in Medicare.
Yep.
And may have a change in health circumstances, may be moving locations, may be just curious to know, much like the statistic that we put at the front end of this of 94% of people enroll in the wrong plan and 87% of the people never change. So
Right.
This is an example of an opportunity for you to get out of that statistic and be proactive in managing your health and your health outcomes by validating every year whether or not you're in the right plan.
Right. And we monitor those plans. We monitor the changes in the plans, and we'd like to be able to monitor the changes that are happening to you, so that if you're moving house or have some major illness or something like that, it's helpful for us to understand that, know that, and to see whether in fact we can make a better recommendation for you as a result of those circumstantial changes.
Right. And we provide the flexibility every day for anyone to reach out independently to info@well-advise.com. Should they ever have any questions, we would be delighted to help participate in managing what those answers might be.
Thank you, Mimi.
Well, thanks everyone. Dr. Morris, as always, you have been an expert and a gentleman. I hope your allergies get better.
I need to see somebody.
No, you need to see a good doctor, Dr. Morris. But it's been a real privilege to be with you today. And for all of those attending our webinar, we thank you for participating, and we look forward to having you as clients and friends and partners during your healthcare life. So thank you very much. We are going to wrap this up today. And should you have any questions, please reach out to us. Have a wonderful day. Bye-bye.
Goodbye.